is time to go to the second leg, which is exaggerated prostate symptom. What are we talking about? What are we talking about? So the people who we have to listen to or believe in this type of situation are the people who are called the urologists. The urologists are doctors that major mainly on the urinary system of both male and female, if you like. Though their major field of operation, their flagship of business is actually the prostate disorder, prostate dysfunction. Urologist, by the way, I will deviate a bit. The urologist is a pressure group, is a trade union, so to say, that major on things about prostate. They are the ones that decide what it is. There are many trade unions, but we call them fanciful name. You can say medical association, pharmacy association. We have to say this so that people will know. Call it pharmacy association, nutrition association. These are the people who have congregated in order to be doing something to protect the profession. That is very good. To popularize it, to make it dominate, to make it to have money, to make it to be in charge. So naturally, there are officers or people that are the one determining will be able to select buckets of information or test the one they accept that will yield maximum benefit for them. They now channel this thing down like good religion. That this is what we believe, this is what we don't believe. It's like actually catechism in religion. Because in catechism in religion, you select the part of the Bible you want to believe and channel it down to it's very. I want everybody to understand this, so that we will be able to demystify many things and know that not just because a congregation says something, it has become fact forever. No. So these people who do that are working on an agenda to make sure that their business is working. And because the pressure group or the association or the trade union also, sometimes they don't want people to post them, they operate a congregation of militia, if you like, enforcers. People who go around like blasphemy enforcers in religion to beat people to come back to what they talked about. Those ones are called council. We have medical council for doctors. We have pharmacy council for pharmacists. We have nursing council for them. We have even nutrition council. Even in naturopathic medicine, they have a council that select the things they want to follow. The things they say this one will not follow. If you bring this one, they fight if they don't like it. Or the one they have deified and congregated and made it a part, customized it for their own business, they follow those ones and follow these ones. So the people who are in charge of bringing out, who are authority in the area of prostate, they are called urologists. So many of what I'm going to say today are things I get from the website of Urologists of America. They are called Urologists Association of America, UAA. I get many. There are official catechisms, so to say, the one they want people to know. I will say it. There are also the one I get from the website where they don't want you to know because it does not favor them. I will also say it, and I want to be proved wrong or punished for that because they say this, but they don't want you to know because it may not be incongruous with the business. So for this particular situation, we are on the symptom now. You remember I said it's exaggerated symptom, it's bloated symptom, it's overblown symptom. There is a clarification. When we are talking of prostate symptom now, it is actually BPH that we're talking about. Prostate cancer doesn't really have very violent symptom. And then the symptom of prostate inflammation, prostate bacterial infection is very fundamental, is known. You have discharge, you have things that are coming out of your urinary something, which is easy for people to know and respond very to treatment. And when you go to lab, you see the organism that is causing it. But when the symptom the urologists are talking about now is the symptom of BPH. Frequent or urgent need to urinate. Urinating more often at night. Trouble starting to urinate. Urine stream that stops and starts. Dribbling at the end of urination. Not being able to fully empty the bladder, urinary bladder. There are many of them. But when you see the contradiction it is difficult to believe that this small useful thing here can do all of them. This night it will stop you from urinating. Tomorrow night it will give you polyuria that you urinate 20 times a day. Tomorrow it will force you when you are returning to your house to go and urinate, even do it before you come down. Another time it will close. I am not saying the symptom is not there. They also say there are people who have normal prostate, but they have all the symptoms. What they didn't say, and which I have added now as 4B, is there are people who don't even have prostate at all, but they have all the symptoms. Do you want to know the people? They call them women, females. They also have all the urinary problem. They have quick urine sometimes. They have polyuria sometimes. They have they have urine treatment. They also use catheter sometimes when urine is not coming out. So it's not only men that it happens. How come it's only when it comes to men we say it is prostate that is causing it? It is wrong. And that is why we have been saying all along that prostate cannot be cured. Because you do not even know what causes it. A man called Winston Spencer Leonard Churchill. Winston Churchill says something. He said you cannot win until you know who the real enemy is. You can only win when you know who the real enemy is. The real enemy that is causing that what we call prostate was not known until now. That is why we captioned our book Prostate Cure Made Easy. Why other treatments have been failing. But for now, we are talking about, you already said, even women have the symptom. So when it happens to women, it is UVD and UFD. But when it happens to men, when you ask the urologist, how come that women have what appears like BPH? How come most men have what you told us is BPH, but they don't have BPH? And that was how they opened a folder, which they now call UVD, urine voiding disorder, and UFD, urine flow dysfunction. And what did they say were the real symptoms? They said this one openly. What are the symptoms of UVD? Difficulty in emptying bladder. That one is UVD. Urinary hesitancy. That one is UVD. Slow or weak urine stream. That one is UVD. Urinary urgency is UVD. Urinary frequency or dripping of urine. Look at this 7. Look at this 6A. They are exactly the same thing. There is something wrong with this assumption. How do you now follow that man up? They say we know what to do. They should go for test. The men should go for test. Since women don't have prostate, they don't send them for test. That is why one wrong thing, one wrong assumption goes to another one. That is why we are the third leg of our discussion today is coming, because we said prostate disease definition, wrong one. Exaggerated symptom, we have dealt with it. So now we are going to the next leg, which is wrong prostate test. Wrong prostate test is wrong because it has been proved to be wrong. It's wrong because of what I'm going to tell you. And I told you that prostate does not kill anybody on its own. It is the test that you do that will program you for treatment, that will program you for surgery. And when you do all the surgery, you see a lot of casualties, a lot of death attributed to prostate. But when this thing is understood and people now know that this thing is what it is, to a large extent, we're going to see less and less and less people dying of so-called prostate disease.